Hello, and welcome to UF Health Wellness University. We have a great subject today that we're going to be talking about, vaccines for kids and expectant moms. I want to welcome you, and I want to let you know a little bit about how it's going to work today. So if you are joining us for the first time, you're going to have the opportunity to ask questions at the end of the presentation. Now, you can give us your question anytime, but at the bottom of your screen, you'll see a little section called Q&A, and you can click on that, type your question into us, and then at the end of the webinar, I will read that question aloud anonymously. So your name's not going to be identified or anything like that. I'm the only person that's going to see your name, but I just want to let you know that you can do that at any time. You don't have to wait till the end. And if you have any questions or want a little more clarification on something, let us know. We appreciate that. And there's also going to be a recording of this webinar if you need to go back and watch it or reference anything that was discussed here. We have several great speakers that are with us today. We're very excited. We're very fortunate to have a great panel of speakers today. Our first speaker is going to be Dr. Lindsay Thompson. After that, we're going to have Dr. Kathleen Ryan. And after that, we're going to have Dr. Sonja Rasmussen. They're all physicians that are associated with UF Health in pediatrics, and they have a great presentation today, and I don't want to take much of their time, but I just wanted to give them a warm welcome and thank them for speaking today. Thank you so much.
Hello, everybody. My name is Lindsay Thompson, and I am the first of three of us that will speak today about what parents and expectant mothers need to know about vaccines. Our outline today will be that I will start and give an overview of vaccines. I am a general pediatrician, the one that you might bring your children to if you have them already for regular well care and acute visits. Then Dr. Kathleen Ryan will talk about influenza and influenza vaccination, and she is a pediatric infectious disease specialist. And in closing, we'll have a discussion of vaccines during pregnancy by Dr. Sonja Rasmussen, who is a pediatrician, a geneticist, and an expert on pregnancy-related exposures, which include vaccination. I first wanted to talk about some principles of vaccination and give some definitions. So first, immunity. Immunity is the ability of our human bodies to eliminate foreign substances. We generate immunity hundreds of times a day, but immunity is generally thought of specific to a single organism or group of closely related organisms, such as a bacteria or a virus, and that is the goal, to become immune to different pathogens. And we specifically strive for active immunity. That's the protection that your body produces by your own immune system. And this is where the immune system is stimulated by an antigen or some kind of provoking agent that produces antibody and cellular immunity. And unlike its opposite, which is passive immunity is temporary. Active immunity usually lasts for many years and often a lifetime, where active immunity can come from surviving an infection. I had chickenpox as a child, or receiving a vaccination. Both my children have received the varicella vaccination, so hopefully they will never get at least a bad case of chickenpox. And vaccines have greatly expanded over time. This is a demonstration first from 1986, where we had 12 shots available to children over their childhood for 8 diseases. But fast forward, we actually can protect now against 16 diseases. And there are a lot of shots that you have to fit in, and that's what this chart is showing. But I show this chart, not that it's not even in focus, I'm sorry, but it's not even something that I would want you to know intimately. This is a chart aimed towards general pediatricians like me to explain a couple different things. And many people find this daunting, but I see it as an opportunity that we can actually save lives. The two aspects that as pediatricians we care desperately about when we're talking about vaccinating children is the timing and the spacing of vaccines. They're the most important characteristics overall. And as pediatricians, we try to make sure your children get it as soon as possible and in the way that's the most effective. We have to balance whether a child might be contraindicated to receiving a vaccination, which is very rare, but luckily rare. But it involves a health condition where the child could possibly have an increased likelihood of a serious adverse reaction. But like I said, luckily it's rare. And we also have to consider special situations such as pregnancy, which we'll hear about later, or if a child is immunocompromised. And these special situations may require extra vaccination, or they may require withholding vaccinations or delaying them because of that person's immune system. And we know as pediatricians, this is a lot to digest for parents, but we also know how many successes vaccines have had. So I'll go into that for a little bit. We've had huge successes through the science of vaccination. We know that annually on a global situation that vaccination reduces over 300 million cases of disease from vaccine preventable illness. We also know by preventing that we reduce healthcare costs significantly from over 21 million hospitalizations and prevent roughly 732,000 deaths per year. And scientists have been so creative and in their types of vaccination, things ranging from smallpox, which the eradication program that started in 1967 lets us not even give the smallpox vaccination anymore, as well as our first cancer prevention vaccine, which is the HPV vaccine, which protects against multiple different kinds of cancer as well. So it's pretty exciting how successful these vaccines have been. If you look closely at any of the vaccines, but I'll use measles here, you can see starting in the 1950s and 60s, down here on this side, we had roughly 500,000 cases of measles every year in the United States. But once the vaccine was licensed, we quickly saw this fall away. And now we only have little tiny blips or outbursts of measles that happen. We hear about them in the news because it is a highly contagious disease. But I'm happy to say that I've only seen a handful of cases as a general pediatrician, but I do work in an academic medical center where we see more. I've only seen a handful of cases in my career that started in the late 1990s. And globally, vaccination successes are incredible. In this visual, the gray parts of each one of the graphs are all other causes of death in children. But if you look at the colored parts and see how these colored parts have reduced over time, you can see, especially in the higher parts of each bar, the colors represent tetanus, pertussis, and measles. These are causes of deaths that are preventable by vaccine. And you can see that those colors, by the time we get to 2017, they're kind of smushed together. What this also shows is that these other colors, this lighter purple and the darker purple, represent all diarrheal diseases and acute respiratory infections. And while decreasing over time, there's still a significant mortality in children. And we have vaccines that cover some of these and prevent or lessen the severity of some of these illnesses, but we still have a long way to go. So as a general pediatrician, I hear a lot of questions about vaccines, and these I hear many excellent questions, and I really welcome them all. But I also hear a lot about myths and misconceptions about vaccines that I want to address briefly today. This slide shows two series of surveys that were sent out, one in 2006 and the other in 2013, about the most common concerns that parents had about vaccines. And on the right-hand sides of the bar graphs, you can see that concerns for autism, concerns about safety, and then the overall sentiment that vaccines are unnecessary are still really prevalent. And I think that this is the biggest concern as pediatrician, is that we want to continue an urgency for the need of vaccines. So talking about vaccine safety, I showed you in the previous slides that vaccines are very effective, meaning they're very good at preventing disease, but they're also very safe. They're so safe that there's no good graph that I can show you on any kind of population level, because adverse events are incredibly rare for our vaccines. We do have a national system called VAERS, which is a surveillance system that's run by the FDA and the CDC together that help us track any concerns that there might be nationally. And we could give a longer talk on that alone, but in brief, the system helps us know how vaccines, how their safety persists over time. And important to think about, though, is that vaccines are working so well that parents may be more likely to know someone who has experienced an adverse event, which may or may not be related to the vaccine, following a vaccine, than they are to know someone who experienced a vaccine preventable disease. So we really need to maintain public confidence in our vaccines, and that's critical to preventing any decline in a vaccine coverage that we might be able to avoid. Which brings me to my last points. Looking at this past decade of vaccination, we've had great success in getting children the majority of their recommended vaccines. This is one study that looked at children under 2, so up until your 2nd birthday. And looking at 2 different time sets nationally, 2014 and 15 to 2016 and 17, national coverage of all these different vaccines remained really high. Up to 93% of kids got their recommended vaccines. However, a little more than half, 58%, got their flu shots, 2 flu shots by the time they were 2. And this study really warned us, it actually came out during the pandemic, that the pandemic may disrupt our national dedication to getting vaccines. And they were very worried about that. They also said because of this low rate of flu, that we as healthcare providers and as parents need to be really vigilant about keeping overall vaccination rate high, but especially the flu, to avoid any co-circulation of respiratory viruses. And this map over on the right-hand side of the screen shows that in the South, in Florida, where we are, obviously, we have some of the lowest flu shot rates, shown here in white, compared to other parts of the country, which have much higher rates. We have somewhere between about 38% to 52% of our 2-year-olds receive at least 2 vaccines of influenza. So that's something that Dr. Ryan will talk about more coming up, but it's very important. And now our last cautionary message. Vaccines given during the global pandemic are in a really precarious position. This is a study that was done in Michigan, but it is being replicated in different parts of this country, which show because of the lockdown, fewer children are able to come to the pediatrician's office and get their routine vaccines. So we have kids that are behind. And here you can see the yellow dots represent 2020. And at every different age and months, except right in the beginning, they have significantly fewer, up to 50% fewer children are up to date by the time they get to 2. So we have a lot of work still to do with vaccination. Dr. Ryan will give you more specifics about influenza, but just remember to get your children fully vaccinated. It is a lot, but it's a great way to save lives. Thank you.
Thank you all for being here. Hopefully you can see my screen. And so I'm going to talk about influenza, the virus itself, so we understand more about flu vaccines, and also a bit about the flu and treatment of the flu. For some reason it's not, there we go. So influenza viruses are actually a group of viruses, and they have a genome that's in pieces, it's segmented, which is what allows for this mixing of the flu viruses. So there are 3 types of flu: influenza A, influenza B, and influenza C. We don't hear much about C because it causes a very mild cold and is not very significant from a disease standpoint. But we do hear about influenza A and influenza B. And the spikes on the surface of the influenza virus are the hemagglutinin and the neuraminidase. And there's 16 different hemagglutinin types and 9 different neuraminidase types. And influenza are found in different species, in particular influenza A. Influenza A is found in birds, wild birds of all types, and even domesticated birds. And the birds harbor all 16 of the hemagglutinin and 9 of the neuraminidase types. Now, pigs can also get flu, and they get influenza A, but only a few of the H and N types, and they can also get influenza C. Now, pigs can get sick with the flu, whereas the birds don't get sick with the flu. They just harbor it in their GI tract. So they're just sort of like the pool of the influenza A virus. Horses also can get flu, and they only get a couple different types of influenza A, but they can also get sick with the flu. And then humans, as you know, we get the flu and we get influenza A. We get the H1N1, we've had the H2, the H3, the N1, and the N2. We get influenza B, unlike other species, and we also can get influenza C. So influenza A viruses are the only viruses that can cause a pandemic because of this big population of the viruses in the birds. So you have this natural population in the birds, and then these wild birds usually come in contact with, say, domestic birds at a farmer's market, or and then they may mix with the virus in the swine. A lot of times we think the swine is kind of the intermediate between the birds and the humans, and then direct contact with the animals can lead to transmission of those viruses into humans. It's probably not going to happen like this at a market or directly, but it is close contact between humans and animals that allows for these new H and N types to be introduced into the population. So this is the history of pandemics of influenza A. You've probably all heard about the bad 1918 influenza pandemic. There might have been pandemics before that, but we don't have good records before the 1918 one. So that's when the H1N1 virus was introduced into the human population. And that it circulated by itself for many years. And then in 1957, it completely disappeared, and the H2N2 virus reappeared in humans and caused the pandemic. And then it circulated by itself until 1968, which was only 11 years. And then it disappeared, and the H3N2 virus appeared in humans. And then this one circulated by itself until 1977, when something different happened, because flu likes to fool us. So it changed the rules a little bit. And instead of the H3N2 virus disappearing, the H1N1 just came back into circulation and caused a pandemic. And then those two viruses circulated together, which is why we have the two A strains in our vaccines, until 2009, when again something different happened, and the H1N1 didn't disappear, but it changed enough so that it was able to cause a pandemic. And since that time, the H1N1 2009 pandemic strain and the H3N2 have been the ones that have been circulating. So it's really not a matter of if we're going to have another pandemic of flu, it's only a matter of when we will have a pandemic of flu. And flu is really not just an average virus, cold type virus. It is really much more severe of an illness than just a cold. And usually it starts with the very abrupt onset of fever. You're completely fine. You know, parents will say, oh, you know, my daughter was fine. And then 5 minutes later, she had a fever of 104. And she, you know, I could hardly get her to drink and move. And if you're an adult, you feel fine 1 minute, and the next minute you feel like you have to climb in bed and that you've been run over by a truck. So you get the fever first and feeling bad, and then within the next 24 hours is when you get your other symptoms. You get the bad muscle aches, the headache, the dry cough, sore throat, and the runny nose. Whereas most respiratory viruses start off with the congestion and the sore throat, and then you may get a little fever in the next 24, 48 hours. Flu goes the other way around. And up to about 20% of young children are so sick looking that they look like they may have bacterial sepsis, and some even have febrile seizures. So we do have prevention for the flu, and this is the key to controlling flu, to preventing really bad outbreaks of flu every year, and to prevent deaths from the flu. The flu in children is different than what we're seeing with our current pandemic virus, in that it is quite severe in kids. Our cardiac ICU people were talking when the current pandemic started, and we're not seeing it in children, and children aren't getting very sick. They reminded us that back in 2009, when we had the pandemic, they had many children, especially with heart disease, that were dying from the flu. So since we have prevention, we need to use our prevention for flu. And the CDC since 2008 has had a universal influenza vaccine recommendation. And that is that everybody, every year, regardless, gets a flu vaccine. Doesn't matter how old you are, what kind of health conditions you have. If you're perfectly healthy, everybody 6 months and older every year should have a flu vaccine. So we have our standard vaccines. For years and years, we had only 3 strains in the vaccine. We had the 2As and we had 1B. And in the last few years, as influenza likes to do, it changed the rules a little bit, and the B strains kind of diverged. And so they had to put 2 B strains in the vaccine. So now they're called quadrivalent. Younger children get a slightly smaller dose, and then children 3 and older and adults get a slightly larger dose of these inactivated vaccines. We also have the live attenuated vaccine, which is quadrivalent, has all 4 strains, and it's called FluMist. And these are live viruses, but they've been weakened with temperature sensitivity and cold adaptation. And so they only grow for a short amount of time in the nose, but enough to give you an immune response. And they're available for anybody 2 years to 49 years without risk factors. You can't get this vaccine if you've got active asthma, not well-controlled asthma, and other disorders such as diabetes, blood disorders like sickle cell disease, or if you have some sort of immune dysfunction. We also have newer vaccines. We have the high dose inactivated vaccine for people over 65 because they don't respond as well. Their immune systems are not as robust against the influenza vaccine, and so this is a higher dose. We have an intradermal inactivated vaccine that's only available for adults. It's the old gun technique for people who really have a fear of needles. That's helpful for them. There's a cell culture-based vaccine. The vaccines for influenza are grown in eggs, except for this one, and this is becoming much more popular. And it's now got approval down to 2 years, and they're working on getting it approved down to 6 months. This takes away the whole issue of, do you have an egg allergy? And then there's this recombinant hemagglutinin vaccine that's called Flublok that just has the hemagglutinin in it that's available for adults. And it's important to note that only the multi-dose vials of flu vaccine contain the preservative thimerosal, and 99.9% of places use individual vaccine dosing, not from where you pull it out of a vial of vaccine. And so none of the other ones except for the multi-dose vials have thimerosal. And it's only anaphylaxis to eggs that is considered a contraindication to flu vaccine. Any other reaction, it's okay to get flu vaccine. So treatment is available also. Unlike for most of the other respiratory viruses, we actually have treatment for flu. The older drugs, amantadine and rimantadine, aren't used anymore because they're not effective. I'm sure most of you have heard about Tamiflu. It's given by mouth. Luckily, there's not resistance developed to this medication so far. It's dosed based on weight and age, and it's given twice a day for 5 days. There are some side effects with all of them. Some nausea, vomiting, some abdominal pain, maybe some agitation or confusion, but it's hard to sort that out as to whether that's really related to the medication or it could be related just to the flu, which can give you all of those symptoms as well. Now, if you're trying to prevent the flu with these medications, like if you have someone who's at high risk and they were exposed, you can give half of the treatment dose once a day. And that's if you're over the age of 3 months. So we also have Relenza or zanamivir, which is inhaled, not oral. And it's approved for people over 7 years of age. Again, it's dosed twice a day for 5 days, similar symptoms and similar side effects. And you can use this also if you're trying to prevent someone from getting the flu. There's a newer drug called peramivir that's given intravenously as just a single dose, and it's approved down to age 2 years in children. Not used very often, but sometimes we'll use it in the hospital if someone cannot take a medication by mouth, or if they're sick enough to be going to the ICU and they won't be able to get anything by mouth. The newest drug, Xofluza, is a different type of drug. It's an endonuclease inhibitor. It's only approved for those over 12 years of age, and it's given as a single oral dose. You don't have to take it for 5 days. You just take one dose. And it has similar side effects, but even though it's the newest one, its use will probably be limited because it looks like resistance to this drug develops fairly quickly. And then there's a few other drugs that are being investigated that we might hear about more in the future. So treatment of flu is recommended for all children less than 5, especially the younger ones, less than 2, for adults over 65 years, for any patient that's hospitalized or has severe, complicated, or progressive disease, and anyone in a high-risk group. And that would include people with pulmonary disorders, including asthma, cardiovascular disease, kidney problems, hematologic issues, endocrine problems, including diabetes, any neuromuscular problems, immunocompromised. Of course, pregnancy is recommended that people are treated during pregnancy. If they're receiving aspirin therapy, American Indians and Alaskans, and anyone in a nursing home. Treatment should be started for all of them within 48 hours of the onset of symptoms, and can be considered for otherwise healthy individuals if it's started within 48 hours. So you definitely want to treat the people that treatment is recommended for, but you can consider it for anybody else if it started within 48 hours. And treatment has both clinical, you'll feel better more quickly. It's not a panacea, doesn't completely take away your symptoms, but people do say that they feel better more quickly. And it also has public health benefits. Just like we're seeing now, it can get people back to work sooner, get back to school more quickly. It does have public health benefits. And studies have shown that early treatment can shorten the duration of fever and illness symptoms by a couple days, 2-3 days, reduces the risk of complications and death, especially for hospitalized patients, and shortens the duration of hospitalization. As I mentioned, it should be started within 48 hours of symptoms, but sometimes it can still be of benefit, and we still do use it if patients are hospitalized with severe, complicated, or progressive illness, even if it started later. So it's especially important this year to get a flu vaccine. There is some data that suggesting that people who get the flu and get the SARS coronavirus, the pandemic virus, that their outcomes are worse, especially if they have other risk factors. So we don't want to see that happen. So it's especially important to get a flu vaccine this year to prevent the flu so we don't have those kind of complications. So now I'm going to turn it over to Dr. Rasmussen.
Thanks. I hope everybody can see my slides. Kathleen, can you give me a yes?
Yes.
Okay, great. It's my pleasure to talk to you today about the importance of vaccination in pregnant women. And the reason why it's important to vaccinate pregnant women for a couple of different vaccines is it can protect not only the mom, but also the baby. So there are two vaccines that are recommended during pregnancy. One is, you just heard a lot about the influenza vaccine or the flu shot, and the other is the Tdap vaccine. And the reason why we think it's important, so important for pregnant women to receive the Tdap vaccine is because of the pertussis part of the Tdap vaccine. And I'm going to tell you about pertussis, which is also called whooping cough, which is a serious illness in babies and can cause hospitalization and death. So first of all, why recommend a flu vaccine during pregnancy? Well, it's important to note that it can protect the pregnant woman, it can protect the fetus, and it can protect the baby after the baby is born. And I'm going to go through each one of those. So first, this is looking at the pregnant woman. We know that when you get pregnant, a lot in your body changes. And one of the things that changes is your immune system. And that's because your immune system needs to adapt. Otherwise, that baby has antigens from the dad. And otherwise, it would be like having an organ transplant that you would reject that organ. So for your immune system to not reject the baby and have a miscarriage, the immune system needs to change. The second thing is your lungs and heart change. And certainly any of us who've been pregnant know that towards the end of the pregnancy, you can barely take a breath. And so you can imagine that you're not clearing your lungs as well if you had a severe form of influenza. And we've seen in several different studies that pregnant women are at increased risk for hospitalization. And some studies have even shown an increased risk of death from flu in pregnant women. What about the fetus? What about, we know that some infections can actually have an adverse effect on the fetus, can cause birth defects or severe problems as the baby is born. And that's true for flu. We know that women who have fever in their first trimester of pregnancy, their babies have an increased risk of having certain types of birth defects. And the best data are available for an increased risk of neural tube defects, such as spina bifida or anencephaly. So we want to prevent fevers in that first trimester of pregnancy. We also know for women who get severely ill with flu, they have an increased risk. Studies have shown an increased risk of preterm birth, being born too early, being admitted to a neonatal intensive care unit, to a NICU, and an increased risk of low birth weight for the time in pregnancy where the child is born. And all those things can affect the baby adversely. What do we know about flu in kids? And you've just heard a lot from Dr. Ryan, so I'm not going to go into a lot of this. But again, as Dr. Ryan mentioned, a lot of people don't realize how serious flu is in kids. And I thought I would show these data from the CDC. You can see that every year, kids die of flu. So you can see in 2017-18, there were 188 kids. In 2018-19, 144. And in 2019-20, 195 kids died of flu. So far this year, the good news is that no kids have died of flu. But we know every year we see kids, a good number of kids, and generally those kids are either too young to get the vaccine, or they're kids that weren't vaccinated. So it shows the importance of flu vaccines for kids and for pregnant women. And I'm going to show you why that is in just a minute. So here's the effects of flu on infants. This shows that the kids that are the most severely affected with flu are young kids. And you can't get the flu vaccine until you're 6 months of age. And you can see that those kids in that 0 to 5 month age category are the highest risk of being hospitalized and of dying. So here you can see as you kids get older, the risk of being hospitalized and of dying is lower. So this is the first study that showed in a really convincing way that a flu shot during pregnancy can protect a woman's baby in the first few months of life. So what this looked at is people were randomized, and you've heard about these randomized controlled trials with COVID vaccine. You basically flip a coin of whether the person got the flu vaccine in this case, or whether they got another type of vaccine. And then they followed the women through their pregnancies. The babies were born, and they followed their babies for the first 6 months of life. What they found is that babies born to moms who had received the flu vaccine during pregnancy were much less likely to get flu in those first 6 months of life. And here you can see this is the rate of getting flu if you got the control vaccine, the non-flu vaccine, and this is if you got the flu vaccine. You can see it's much lower, 63%, or about 2/3 lower if the mom received the flu shot. And it was really convincing data. You couldn't say, well, it's because somehow moms who get flu shots are healthier because it was a randomized study. So how does giving a pregnant mom a shot protect her baby? And this is for both the flu vaccine and the whooping cough vaccine that we're going to talk about in a few minutes. About 2 weeks after vaccination, so you don't have a response to the flu vaccine right away. And same thing with the pertussis vaccine. It takes some time for your body to make that immunity that you heard Dr. Thompson talk about. But about 2 weeks after the vaccination, the mother starts to develop antibodies to influenza for the flu vaccine or whooping cough for the Tdap vaccine. Those antibodies are able to cross the placenta freely from the mom to the baby. And then the baby's born with antibodies. Those are kind of temporary antibodies because eventually they'll wane and the baby is going to need to make their own when the baby starts getting their own vaccines. But the baby can then be born with protection against influenza and whooping cough for the first few months of life. And I've told you those first few months of life are the most dangerous for kids for flu. And I'll show you they're the most dangerous for kids for whooping cough too. So what are the current recommendations? These are the recommendations from ACOG, which is the American College of Obstetricians and Gynecologists, and also from the CDC for this current flu season. All women who will be pregnant or are pregnant or postpartum during the flu season should receive the flu shot. And it can be administered at any time during pregnancy, and any of those types of shots that you heard about from Dr. Ryan can be used. Pregnant women should not get the nasal spray, should not get the mist, the flu mist. That is not recommended since it's a live vaccine, and live vaccines are not recommended during pregnancy. So now I'm going to switch gears and talk about pertussis or whooping cough. It is caused by a bacteria, where flu is caused by a virus. It's very contagious, easily spread from person to person by coughing or sneezing when you're in close contact. And it really causes uncontrollable violent coughing where kids will cough and cough and cough, and then they try to take a deep breath, and that deep breath that they take is where the word whooping cough came from, because they basically make a whooping sound. This is a scary sound in a child, and I still remember a child that had severe pertussis from when I was a pediatrics resident almost 30 years ago, remembering hearing this child, and the child was unable to eat because they couldn't stop coughing to be able to eat and had to be admitted to the hospital. There are nearly 200,000 pertussis deaths in kids per year worldwide. And there are two different kinds of pertussis vaccination. There's the Tdap, and that's for kids that are less than 7 years of age. And then there's the Tdap, which is for older children and adults. And I'm going to be talking mostly about the Tdaps because that's the one that will be given to pregnant women. Of note, these both contain tetanus, diphtheria, and pertussis. Protect people against those three. It's just different doses that are given, whether you're a child or whether you're an adult. So here, I just want to show this. This is one of the things similar to what you saw in Dr. Thompson's talk of the effects of vaccine. You can see how many cases of pertussis were seen in the United States before there was a vaccine. And you can see here the vaccine became available and how quickly those numbers dropped. You can see here they changed to a different type of pertussis vaccine that was less likely to cause fever. And of course, that's a good thing that there were less side effects, but it wasn't as effective. You started seeing some increase in cases here. And then they started adding the Tdap vaccine for adolescents and adults that was able to drop cases a little bit, but then we started seeing cases again. The worrisome thing about these cases that started to be increased here are that they were cases in young kids. And I'll show you that here. Here you can see through the years from 1990 to 2018, who are the people most likely to get pertussis? It's kids less than 1 year of age. You can see in this deep pink, these are kids with less than 1 year age. You can see the rate in all other categories is much lower. So this is information about pertussis hospitalizations in infants less than 12 months of age. Again, you can see the kids that are most likely to be hospitalized and death data follow are kids that are in that first 0, 1, 2, 3 months of age. So that early on time period. Pertussis vaccine you can get earlier. You can get it starting at 2 months of age, but it isn't fully protective until you have all the doses. And so you can see that that rate is really high in those early months, especially the first 2 months before a child can even get their own vaccine. And the only way they can be protected is through their mom. So here, people of all ages need whooping cough vaccines. I've told you about the special kind that's for kids under the age of 7. That's given at 2, 4, 6 months, 15 through 18 months, and then 4 through 6 years. There's the Tdap that's recommended for preteens. That's the same one that's recommended for pregnant women. And then for adults, and I just want to mention this, if you're an expecting mom and your grandparents, your parents are going to come visit, grandparents, babysitters, and so on, you need to be sure that all of them have had this vaccine because you want everybody around the baby to also be protected so they don't give pertussis to your baby. So what are the ways to protect infants from pertussis? Because we know it's a serious disease. It can cause hospitalization and death. The best way to do it is to get vaccinated when you're pregnant. And that has been shown to drop substantially the rates of pertussis in children. And in the United Kingdom and England, where this has been done pretty much universally, the rates of kids getting sick and dying of pertussis have dropped to very low rates. You can surround the babies with indirect protection. That's called cocooning. And here's a picture of that here. You want everybody who's going to be around that baby. That baby's going to have some protection from the mom getting the vaccine during pregnancy, but also you need parents to have had the Tdap, child care providers, we have babysitters, grandparents, and then brothers and sisters all need to have received the whooping cough vaccine. And then, of course, it's important to vaccinate babies on time. And you heard about that from Dr. Thompson. So what are the recommendations for Tdap shots during pregnancy? The recommendation is that pregnant women should receive the Tdap vaccine shot during every pregnancy, even if they've had it before, they need it again. And that's because we want those levels of the mom's antibody to be high at the time the baby's born. The recommendation is for it to be administered between 27 and 36 weeks, ideally a little bit earlier in that time period, because we know that some babies are born preterm. And if you wait till late and then the baby's born preterm, you don't have the chance to give the vaccine. In addition, remember that it takes a couple weeks for that those antibody levels to rise after you get a vaccine, and then for those to pass across the placenta and protect your baby for those first few months of life. So how are we doing with this as a country? These are data from a study that CDC did in 2019. You can see that we're not doing as well as we would like. Little over half of women got the Tdap vaccine during pregnancy. Again, a little over half of women got the flu vaccine during pregnancy, and it should be 100%. And only 35% received both vaccines. So we have a lot of work to do to let people know about the importance of these vaccines, making sure that OBs offer the vaccine and that women get that vaccine during pregnancy. So I just want to mention that there are a number of other illnesses that cause severe illness in babies that have vaccines under development to prevent adverse outcomes during the pregnancy and then in infants. And here's a list of some of those. Some of these vaccines would be given during pregnancy. Some of them would be given before pregnancy to prevent the woman from ever getting the disease in the first place. So here, just in summary, a shot of protection for you and your baby, that's for flu and Tdap shots. Pregnant women can protect themselves and their babies by receiving the flu and Tdap shots. It's almost a 2-for-1 deal that the mom gets a vaccine, but she can protect her and her baby for those first few months of life until the baby can get their own vaccines. Despite evidence of effectiveness, and there's a lot of data about safety on both these vaccines, the coverage rates have remained around 50% for several years, right? Hovering in that 50 to 52 to 55%. And we have a lot of work to do to improve that. And then there are new vaccines for use in women to prevent illness and death in their infants that are in our future, and looking forward to those. So questions, my email address is here if you have questions, or we're happy to answer them now if you want to put them in the Q&A function. Thanks.
All right, thank you, everyone. That was a great presentations. All three of them were great. We've had a couple questions that have come in, so I'm gonna read them out loud and I'll let you guys decide who is the best person to answer this question. The first one that came in is, my child is afraid of shots. How can I help them to make getting their shots or vaccines easier?
I'll take that one as the general pediatrician. I'm sorry, my screen froze for a second. So as a general pediatrician, I can promise for my own children and for all the children that come in the clinic, nobody actually likes to get a vaccine. And children will take a lot of cues from their parents. So I always recommend several things. First, I have parents just acknowledge that to the child that, yes, it's a small negative, but a huge positive. And it's because we love them that we want to give them these shots that protect them. And honestly, their calm delivery of that kind of message can do a lot for children. Another thing that I recommend is distraction. I'm not one to say, to look at a phone or something else, except in this situation, it can be very wonderful to be distracted. There are also little pieces of plastic that have little nubbins on them that a lot of offices have. They're called shot blockers. And it's actually amazing that for kids who might be a little bit anxious, you can put it on the skin. And I'm splitting my fingers if you can see it, where the nubbles would be underneath where I am, and you put the vaccine in between it, and it literally tricks your mind. You're not quite sure what sensation is coming at which time. And then the last level for kids, because there are children who learn, they tend to be the teenagers, learn a great deal of fear, that there is some numbing cream that we can put on. It takes about 45 minutes to work. So if you have time, we can put it on the start of the visit and at the end. Most of the time, it's the worry more than the actual event. So it's just calming the child down right from the beginning, and your pediatrician can help you with that.
Okay, thank you. Another question we got was, are there any vaccines I shouldn't get when I'm pregnant?
There are some vaccines that should not be given during pregnancy, and those are live vaccines. It's interesting. So I had already mentioned the live influenza vaccine. The flu mist is not recommended during pregnancy. The MMR is not recommended during pregnancy. The measles, mumps, rubella, and the varicella shot is not recommended during pregnancy. The other, and those are because they're all live vaccines. I have to say that the studies that have been done looking at those live vaccines when they've been inadvertently, accidentally given during pregnancy because the woman didn't know she was pregnant, they have not seen adverse effects. They haven't seen the babies getting birth effects. So it's more of a theoretical risk, but we don't want to take any risk in a pregnant woman. And so live vaccines are not recommended. Other vaccines, it really depends on the vaccine and why the woman's getting it. HPV vaccine, again, is something that you wouldn't want to get during pregnancy, but if you got it, probably not something that is going to cause problems. But there are, so for example, if a woman was bitten by a dog that they might have had rabies, you would want to get the rabies vaccine during pregnancy. You wouldn't normally get a vaccine for rabies during pregnancy. So it's all weighing the risks and the benefits for the other vaccines. The ones that everyone should get are flu and Tdap. The others, it really depends on weighing the risks and the benefits. What are the benefits of getting that vaccine during pregnancy versus the risks the woman.
Okay. Can you, another question that came in is, where can you get, if you don't have insurance, where can someone get vaccines, that are more affordable or free?
Marcia, can you unblock my video? And I'll take that one.
Yeah.
I don't know why it says you're blocked. It's blocked.
Let's see.
So there are actually a lot of options for getting vaccines at different places. In the state of Florida, you can't get a flu vaccine or other vaccines at a commercial location like Publix or CVS under the age of 18. Some states you can, but in Florida you can't. The health department has vaccines. If you don't have insurance, in most children will have Medicaid insurance, even if they're low income, and you can get vaccine there. All childhood vaccines are covered that way. Adults can pay out of pocket at a commercial location, go to the health department. Here in Alachua County, we do flu vaccines in the schools at no charge to the students. So you can do it that way. We also have a program in the high schools in Alachua County where we go in January and February and offer catch-up vaccines for Tdap and the hepatitis A vaccine and the HPV and meningitis vaccines. So those are options for getting vaccinated.
Okay, good. All good resources. Thank you. Someone asked, is whooping cough prevalent in the United States?
Yeah, because I saw that picture, that question, I was able to look up. There were, because I wouldn't know this number off the top of my head, but there were over 15,000 cases in the United States in 2019. So I think given that there is a vaccine available, there are still a lot of cases. And so I think it keeps in mind the importance of getting your child vaccinated and moms vaccinated during pregnancy. There were 9 kids who died in 2019. So, comparing it to flu, it shows how important flu is when you see that in the last couple of years, about 200 kids died of the flu. So the flu shot is really important. But pertussis, 9 kids dying last year, even though we've had a pertussis vaccine available for a long time, it shows how important it is. Those are completely preventable deaths.
Wow. Okay. Thanks for looking that up. How early can a premature baby get vaccines?
I can take that one. That's a really good question because we do the timing and the spacing of vaccines are really important. And so is your birth weight. There's one shot, the hepatitis B vaccine, that you have to be over a certain weight. That's 2 kilograms. So if you're born in and you're in the neonatal intensive care unit, they wait to give you that shot until you're old enough, or usually right before you're going home. And then if you're born earlier and you're in the neonatal intensive care unit, you cannot get a live attenuated vaccine. We've been talking about those. And there's something called rotavirus, which is actually an oral. The babies swallow it and actually usually like the taste. That one's easy. You cannot get that in the neonatal intensive care unit either, because there is a small but real risk that you could actually end up spreading it around the ICU instead of protecting the children. But otherwise, we try to get babies, no matter how early they're born, right back onto that schedule, especially in your primary care office, depending how long the babies might stay in the intensive care unit. We try as soon as is safe to get the babies caught up. So by the time that they're just a few months old, they're getting the vaccines in the same schedule as all the other children.
Okay. We also have another question. If available, would you recommend pregnant moms get the COVID-19 vaccine?
Yeah, I'll take that one. I think right now we don't have enough information about the COVID-19 vaccine. As you know, all we've seen so far is press releases. So the companies have put out press releases, but in the next couple of weeks, we're going to have a lot of scientists looking very carefully to see What are the side effects? How often do side effects occur? Is this a safe vaccine? I'm hoping that we're going to see how often do people get a fever, because I think that's something that will help us know information about pregnant women. Some of the vaccines, there are several different types of vaccines. Some of those companies are talking about starting to test those vaccines in pregnant women. I think that'll be helpful to let us know whether it's safe in pregnant women. We do know pregnant women are at increased risk for severe disease with COVID-19. They have somewhere 1.5 to 2 times risk of severe disease or even death from COVID-19. So it's really important if you're pregnant to protect yourself against COVID-19. It doesn't appear to cause birth effects like what we saw with Zika. It does appear that moms are more likely to deliver babies preterm if they have it closer to the time of delivery. So it's really important that women not get COVID-19, especially in this time. We think of vaccines coming and hopefully rates are going to go down after those vaccines, after people get the vaccines. But I think to answer the question about whether a woman should get the COVID-19 vaccine right now, we need a lot more data. I think we're going to have some of that data soon.
Okay, thank you. Another question. We know that with the flu, if the vaccine does not cover this year's current strains, someone could still get the flu. Is this similar with other common diseases that we're vaccinated for?
I can take that one. So the flu vaccine is a little bit different than the other vaccines in that we do have to get it every year because the viruses change. They may have a significant change, like if we have a pandemic, but every year they do change a little bit so that we have to get the flu vaccine every year. And their effectiveness varies too. Sometimes it's more effective, sometimes it's less effective. But that's most of the other things that we vaccinate for, there's longer lasting immunity. The pertussis vaccine does wane, and that's one of the reasons why people have to get revaccinated. But most of the other ones hold. Tetanus, for instance, you're supposed to get a booster every 10 years. They include the diphtheria with the tetanus just to continue your diphtheria protection. So it varies by vaccine, but most of them are longer lasting than the flu.
Okay, I don't have any more questions in our Q&A. Is there anything any of you guys would like to add? No? All right. Well, I thank you guys all for your time today. I thank you for the people who attended today and watched this. And I hope you guys all have gotten your flu vaccine, or at least will think about going to get one now. And if you're not caught up on vaccines for your children, give your pediatrician a call or go to the health department. I'm sure they can help you out there. Thank you so much, everyone. Goodbye.